Hello everyone, my name is Kirill Osipov. I am a manual therapist, a sports medicine doctor, rehabilitation and therapeutic physical culture. In this video, I want to give you some advice on how to behave during the flu season. So the first piece of advice will be this. Try to take a decompression position for the spine as often as possible during the day. That is the position in which you experience the least amount of pain. Most often, this will be the position when you are lying on your back with your legs bent at the knees and hip joints at 90 degrees. The next advice will be this. Try to sit as little as possible. If you are forced to sit a lot at work, then at least once every half hour try to take breaks to just walk a little. When you sit, your tailbone should always touch the back of the chair. Do not slide off the chair. Another very good option for you would be to use a lumbar roll. The roll should be right under the lumbar, that is, it should not lie on the base of the chair. To properly place the roll, you need to lean your tailbone against the back of the chair, make a tilt with a straight back, and place the roll. This way the roll will not fall onto the seat and will end up exactly where it should be. Walking will also be an important recommendation. Try to walk as much as possible. The minimum number of steps you should take in a day is 10,000. And you should walk not as if you're on a leisurely stroll, but with a sufficiently high intensity. At a pulse of around 100 to 110. 20 beats per minute. To more accurately determine the pulse at which you should walk, you can use the following formula. You need to subtract your age and multiply the resulting number by 70%. This will be approximately the average pulse that will correspond to the level of aerobic load, that is, the load at which your vessels will work to the maximum. They will open up, blood flow will improve, and recovery processes will go faster. At the same time, there will be no significant load on the spine. Throughout the day, try to avoid inclines as much as possible. All bending loads should be performed with the help of leg bending, not waist bending. If we're discussing a lumbar hernia, therefore, you should clearly track those moments where you use excessive bending and try to get rid of them and eliminate them. Most often it starts from the very morning at the moment when you get out of bed. This is the first bending load you get. The second is when you got up from it, went, for example, to the toilet, started to wash, and so on. There are many of them throughout the day. For example, when you tie shoelaces, get something from the lower shelves. And all this load needs to be removed as much as possible. Also, a good option for you would be to ensure a comfortable placement of things that you use throughout the day at the necessary levels. That is, the things that you use most often should be accessible to you and approximately located somewhere at chest level, so you don't have to bend over to use them. The things you use less often should be approximately above your head, and those things that you hardly ever use or use very rarely need to be placed down low. If you want to lie down, a good option would be to lie on your stomach. If lying on your stomach is difficult due to heavy loads, try placing a pillow under your abdomen while in that position. Sometimes it's necessary to put 2-3 pillows to make it not hurt. Gradually, over time, as your pain level decreases, you can remove the pillows, and first you will go into a horizontal position on your stomach. Then you can lie on your elbows and further go into the exercise, which is called Mackenzie bends, to make your hernia go away faster. I also recommend paying attention to your bed, to look at it from the point of view. Is it too soft? For a hernia, lying on a soft bed is bad, and we get a hammock effect, and again we get an additional household bending, which negatively affects the hernia. As for the exercises that need to be done in the acute period, first of all, they should all be in the horizontal plane. Don't try to strain your spine or strongly massage any trigger points. All this will need to be done, but it will need to be done later. So start with the simplest exercises. The simplest exercise is just you lying on your back and rotating your feet to one side, to the other, up and down. This is necessary for the body to understand that it needs the nerve that is blocked, and it tries to restore its functionality. Another good exercise will be tearing a rubber band in front of you. That is, you take a rubber band that is stiff enough, which you can, for example, tear at the chest level 30 times. And during the day, do these exercises 2 approaches of 30 repetitions. 3, for example, 3 times a day. Just also to speed up the blood circulation, increase the exchange of substances. Another important exercise will be trying to stand on your muscles. That is, you stand up to the wall, lean on it with your hands and stand on your muscles. Slowly and smoothly you let yourself down. This is also necessary for the body to understand that the nerve that is blocked at the moment is needed and it tries to restore it. You need to do the exercise twice a day, 3 sets of 20 repetitions each. If you can perform this exercise on one leg, then it will be a good option. Another good exercise would be the one where you lie on your side and do so-called nerve stretches. That is, an exercise for neurodynamics. This exercise is necessary to improve the nutrition of the blocked nerve. Also, if you can, I recommend starting to do the Mackenzie exercise. The Mackenzie exercise is performed in such a way that you lie down, metaphorically speaking, like a banana, so that the inner part of the banana is conditionally on the side of the pain. And you do bends. And if it doesn't hurt you, try to do them at full amplitude. If at first this will cause discomfort, you gradually, slowly, with each time, try to add a little amplitude and perform these exercises twice a day, 2 approaches of 20 repetitions each. Often during treatment, the condition changes from day to day. Sometimes it gets a little better, sometimes a little worse. And if you look too closely at this, you won't be able to objectively assess your condition. Let's say you have a severe bite. Describe all the symptoms, take a notebook, write down how you feel. Do you have night pains? Are they less? Rate the level of pain on a 10-point scale. Be sure to write down where it is. Pain can be located in areas such as the heel, buttock, or leg. Provide detailed information about how much you can walk or sit without experiencing pain. So, describe your condition in as much detail as possible. This is necessary so that the patient can objectively assess their condition during treatment and the performance of correct exercises and maintaining the correct regime. Because often it happens that the patient cannot objectively assess their condition and remember how they felt a week or even 2 weeks ago, and they may mistakenly remember that their leg hurt, and it will seem to them that the leg hurt before and it still hurts now. But in that case, for example, the foot hurt and now the thigh hurts, and for doctors this will be a good sign, and it says that the treatment is going in the right direction. In general, to properly assess your condition, you need to remember that the pain should leave the leg and concentrate in the lower back, as the source of pain is the lower back, and accordingly, it should hurt there. If you had pain initially in the lower back, and then it gradually began to descend lower and lower, this says that you are doing something wrong and you urgently need to review your treatment. Patients often ask what they should avoid doing when they have a hernia. So, during the acute period of a hernia, the biggest mistake would be to make excessive movements, that is, the very notorious bend. The bend is essential but should be done later. Following the stages is crucial in treating hernia. In the acute and sometimes subacute period of hernia treatment, immobilization is necessary. I consider a disc hernia as its fracture, and the disc needs a lot of time to heal, and for this, immobilization is needed. If our bones fuse approximately within a month, then for the disc to fuse, we may need about 4 months. And ideally, observe the principles of immobilization and safety for the spine during all these months. I also do not recommend using a swimming pool as therapeutic training during the acute-subacute period. I do not recommend going to a sauna or conversely overcooling your spine, and I do not recommend using aggressive manual therapy, as all this can significantly worsen your prognosis. I also want to say a few words about the treatment of intervertebral hernias in other departments of the spine. The main principles of their treatment will be the same. That is, immobilization, increasing overall blood circulation, avoiding harmful positions for your spine. Usually all these positions are associated with inclinations, whether it's the head, the thoracic spine, or the lumbar. Another good option would be to try to create maximum immobilization for the region. Try to move this part as little as possible, especially in the direction of bending, because when we bend, the pulposus nucleus, which is inside our disc, moves towards the spinal cord, exactly where our roots are, which can be compressed by a hernia. I also want to remind you that in the last video I talked about stimulation methods that allow to speed up the healing of a hernia and the recovery of a patient approximately twice as fast. That is, we get faster healing and faster relief from pain. But I want to emphasize that patient management online is also possible. For this, the doctor needs to see your magnetic resonance imaging in order to make the correct rehabilitation program, give recommendations on the regime depending on your specific injury, and guide you through all the stages of rehabilitation that I talked about earlier. However, a visit to the doctor will be more effective as the doctor has various manipulations available that can immediately reduce your pain syndrome. That's all from me. In the following videos, we will show you exercises that will reduce your pain and help heal your hernia.